Welcome to learning about Medicare. We're going to give everybody another couple of seconds here just to log on. We're still waiting for a couple of those stragglers. So we're going to give it about another 30 seconds or so. We're actually supposed to start right at 1:30. Got another 20 seconds or so, but we're going to give everybody a little bit extra time. So hang tight for maybe another minute or so, and we'll get started to talking about that wonderful subject of Medicare. Let's go ahead and get started. I want to be mindful of your time and welcome to learning about Medicare. My name is Lon Broske. I'm a certified financial planner with Pines Wealth Management in St. Louis. And boy, Medicare is a heavy, heavy subject. A lot to learn in this half hour that we're going to be together, and not going to try and make you an expert. Just want to try and give you important information where you can make educated and intelligent decisions about which option on Medicare is right for you. And this is our third webinar that we've had over the last couple of months. And this is the probably the most difficult one because there are so many options within Medicare. We talked about Social Security. That one was heavy. And we also talked about long-term care. And then today, another heavy subject in Medicare. So we're glad that you're here with us today. We're going to try and be efficient with what we do and going to try and get you out of here within a maybe 30-minute time frame. So bear with us. The important stuff before we even get started, just wanted to make sure that you know that this presentation, the content of this presentation is just for your information. We're not trying to make you experts. We're not trying to have you use this information to make a decision right now today. We're not going to talk about any specific products, but I do encourage you that after this webinar has concluded to explore the resources at medicare.gov. That's medicare.gov. There's a lot of good information on there, although it can be kind of cumbersome to sort through, but we're going to cover a lot of that information that's on that medicare.gov website in a consolidated presentation. So let's get started. Information overload. Wow. You talk about Medicare, you talk about information overload. And Medicare is so important because it happens at an important milestone in our life. And we've all had milestones, right? We've graduated, we've bought our first home, maybe became a parent, got married. I just recently turned 50, which is a big milestone, right, for everybody. And when you turn 65, that also is a major milestone in your life in that you're eligible for Medicare. So as you get close to that age 65, you're going to start to get a lot of information about Medicare, about the Part A, about Part B, about the prescription portion, about the skilled care portion. And so our object here is to give you some of these basics of what Medicare is, because some of those mailers that you're going to start to be receiving, some of them are just simply marketing. It's not if it doesn't come from medicare.gov, then it's a marketing piece that a particular company puts out in order to get you interested in their either supplement plan or their alternative to Medicare. And there's a lot of different advertisements, flyers that you may get that may be perfectly legitimate and great choices for some people, but are they right for you? Are these Medicare plans that being advertised to you, are they right for you? Well, that's really hard to tell because there's so much information being thrown at you. It almost makes you want to scream, right? Just like this guy. But we believe that the more information you have, the better choices you'll be able to make. You'll be able to assess your situation a little better and make those better decisions, which ultimately help you in your retirement plan. So what are we going to talk about today? Well, very simple. We're going to talk about three areas. Number one, what is Medicare and when do you enroll? Spend a couple of slides focusing on that. Number two, the different parts of Medicare, their each coverage and cost, because common misconception with Medicare is that it's free. No, you got to pay for Medicare, and we'll dig into that a little bit. And then we're going to talk about supplemental policies and Medicare Advantage plans, because while Medicare is an effective tool for healthcare for those that are 65 and older, it's not the end all beat all. There are some gaps in it, and there are some things that you need to be aware of. And then last but not least, we're going to sum everything up, and we're going to talk about what could be the next steps that you could take in order to get your Medicare plan shored up, especially if you're getting ready to approach age 65. But question number one, what is Medicare and when do you enroll? Well, let's talk about eligibility first of all. Eligibility, got to be 65 years or older. If you qualify for Social Security, in other words, you have collected enough credits for Social Security, or you have enough credits with your railroad retirement benefits, you qualify for for Medicare. Even though you may not be receiving your Social Security benefits, you will have to apply for Medicare. And again, we'll talk about that in a little bit. But if you're a US citizen and you've been here 5 years, living in the United States for 5 years in a row prior to applying, you are eligible for Medicare. So again, two major things as far as being eligible for Medicare: being able to collect your Social Security, and if you're a US citizen and have lived here more than 5 years. Now, if you're under age 65, you have to meet some requirements there to be eligible for Medicare. Number one, you have to be covered under the Social Security Disability Insurance Program or the Railroad Disability Insurance Program. And you have to have been covered for at least 24 months. If you have ALS, commonly referred to as Lou Gehrig's disease, you are going to be eligible as well for Medicare. But again, you have to be receiving benefits under the Social Security Disability Insurance Program, and you have to have been doing that for at least 24 months. So even though you're not under age 65, you could potentially be eligible for Medicare. And last, but certainly not least, is that you have end-stage kidney disease. You could have Medicare coverage. All right, so let's talk about the magic 65. Okay. Now, if you're already collecting Social Security benefits, you're going to be automatically enrolled into Medicare, Parts A and Part B. And that will happen the first day of the month when you turn 65. Now, unless your birthday falls on the first of the month, which some of us do, right? But if your birthday falls on the very first day of the month, your Medicare coverage is going to begin on the first day of the previous month. So if you're already receiving Social Security benefits, you will be enrolled. If you're not collecting Social Security benefits, in other words, you're still working, you've decided to let your Social Security benefits continue to grow, and you're 65, you will still have to enroll. And you have a 7-month initial enrollment period, which is what you're looking at here. So before you turn 65, you're not on Social Security. That 7-month initial enrollment period includes 3 months before you turn 65 and 3 months after you turn 65, in which you need to enroll in Medicare. And also, obviously, the month of your birthday is that 7th month. So you need to make sure that you are enrolled if you're not currently taking Social Security benefits. What happens if I want to work past age 65? Now, this is a common occurrence. We see this a lot with our clients, that they're continuing to work longer. And if you're age 65 and you're still working, you have some choices. And these are some of the more common choices. A lot of people talk about sticking with their current insurance, health insurance provided by their employer. Others want to enroll in Medicare, get off their plan at work and get on Medicare. And then the other is some people choose to combine the coverages. And so we're left with that decision of what do we do? Do we stay enrolled with our employer insurance? Do we enroll in Medicare? Do I do a little bit of both? And we're going to learn a little bit more about Medicare as far as enrolling in Parts A and B. And you can actually enroll separately in Parts A and B and still continue to work. But again, that magic age is 65. Once you reach that age, you have to enroll in Medicare. Now, whether you choose to stay on your employer's plan, that's going to be entirely up to you, because Medicare is going to enroll you once you reach age 65. Okay. And they don't know that you are deciding to stick with your employer. There's no way for them to know. So you may still be working and you decide that you want to stick with your insurance through your employer, and all of a sudden you get a Medicare card in the mail. And you go, wait a second, I didn't sign up for this. But because you're 65, Medicare is going to reach out to you and enroll you in Part A. And if that happens to you and you're still working and you're still covered under your employer, you're going to have to return that card back to Medicare and let them know that you're choosing to keep your health insurance through your employer. What are the different parts of Medicare? Because each part that you choose in Medicare has coverage limitations and costs. Because again, the biggest misconception of Medicare is it's free. It is not. Here's the other thing that I'd like to emphasize with you. Medicare is an individual choice. When you sign up for health insurance through your employer, there's an option for you to provide coverage for your spouse. Many employers do that. Some do, some don't. But if that was an option for you, you signed up for your spousal benefits without the spouse making any choices, without your spouse making any choices as to far as what options they wanted. Medicare is not that way. Medicare, you have to sign up individually. So it doesn't matter how long you've been married, you and your spouse each have to sign up. And there's two major options when it comes to Medicare. Number one is the original Medicare. That's the Medicare that we grew up with. That's your mom and dad's Medicare. It consists of two major parts, Parts A and Part B. In addition to Parts A and Part B, you can choose Medigap Medicare coverage. And Medigap Medicare coverage consists of a lot of different parts, but some of the more one of the more common Medigap coverage policies is Part D. And Part D is prescription drug insurance. Now, keep in mind that with this original Medicare, you're going to have monthly premiums with Part B. And we'll dig into that in just a minute. But you're going to pay premiums. And this original Medicare, you're going to have deductibles, you're going to have copayments, and you're going to have coinsurance. It's not free. And so we want to talk about what the costs are and what the limitations are in just a minute. The other option for Medicare coverage is the Medicare Advantage plan, otherwise known as Part C. Now, the difference between original Medicare and Medicare Advantage is that Medicare Advantage is offered through private insurance companies that are approved by the government. The Medicare Advantage program is not a government-run program. You have options with the Medicare Advantage plan. Now, the Medicare Advantage plan is going to be helpful to you to reduce your costs, but there's also going to be limitations. And then once again, as we go through this, we're going to dig a little bit deeper down into the Medicare Advantage plan. But the other interesting thing here is if you plan to do a lot of traveling, okay, the original Medicare plan, Parts A and Part B, if you plan to travel, let's say you're a snowbird and you spend part of your time here in Missouri, you spend the other half of your time as a snowbird in the wintertime down in Florida, Arizona, or Texas, or wherever, warmer climate, so long as if it is in the United States and your provider, wherever you are, accepts Medicare, you're covered under Original Medicare. Now, your Medicare Advantage, that's a little different. And again, we'll talk about that. But if you travel overseas, once again, your Medicare will cover you. Essentially, how Medicare covers you if you're overseas and if you should have a medical emergency, essentially what Medicare does is it covers to patch you up, and then full coverage is going to start once you get home. So Medicare does work overseas, but if you're going to become a permanent resident overseas, then Medicare is not going to work for you. But it's going to help you get you through that emergency when you're out of the country. The other thing, interesting thing here, is that Medicare Advantage is a PPO and an HMO option. But again, we'll talk about that in just a couple of minutes. So let's get back to that Original Medicare. Let's talk about Part A. What does Part A cover? And I always think about Part A being Part A, how I always remember what it covers is because the A looks exactly like a tent. And a tent means shelter, and shelter means hospital. I know it's kind of a silly way to do it, but that's how I remember what Part A covers. Part A covers your hospital. And everything in the hospital has to do with inpatient care. So it's going to cover your care at the hospital. It's also going to cover your care in a skilled nursing facility for up to 100 days following an admittance. It has to be 3 days or longer to a hospital. Important point, and we'll hammer on this a little bit more because we talked about this in our last webinar. Medicare does not cover long-term care. It doesn't cover it. It only covers short-term care in a skilled nursing facility. And it also covers hospice care. Home health care, you have to meet certain conditions. And once again, it does not cover long-term care. But if you have to have a nurse come in and, for instance, you need some physical therapy and you're going to have a nurse come into your home a couple of days a week, so long as Medicare signs off on that coverage, that will be covered under Part A. But only when certain physician certified conditions are satisfied in that home health care here will it be covered. Basically, get it approved before you accept the care that you're going to be given. Part A premiums. Well, Part A premium is going to be free for most of you who have qualified for Social Security. And again, that's the 40 calendar quarters or 10 plus years. And we talked about that in our Social Security webinar a couple months ago. If you missed that webinar, you can find it on our website as a replay, and that might help you determine whether or not you're eligible for Social Security. But if you are eligible for Social Security, Part A, your premium is covered. Now, if you're not covered, if you're short, you're not covered by Social Security, but you're still age 65, that's where the premium comes in. You could be $259 a month for 2021 if you have between 30 and 39 quarters, between 7.5 and 10 years of work. So you're not quite eligible for Social Security, but you do have some credits. That premium is going to be about $259 a month. And if you have fewer than 30 quarters, if you work fewer than 7.5 years, but you still have some quarters underneath your belt, that's going to be $471 a month. And again, these are 2021 figures. Okay. So if you're covered by Social Security and you're going to receive a Social Security check, no worry. You will not have any premiums associated with your Part A, but you will have copays and you will have deductibles for Part A. And here's the thing that I'm going to keep talking about throughout our entire webinar is that there are no out-of-pocket maximums. Unlike traditional health insurance, like many of you have already, a lot of policies have out-of-pocket maximums. Medicare does not. And it can get pretty complicated as far as what Part A covers. And we'll dive into that a little deeper here in a minute. But let's talk about Part B. What does Part B cover? Essentially, Part B covers outpatient care. Doctors and physician services, ambulance services, durable medical equipment, any any preventative type of benefits, an annual wellness check, mammograms, things like that, bone mass testing, cancer screenings, that's all considered outpatient care. Those are covered under Part B. Now, we're going to get into some exclusions here in a minute that are not covered under Medicare, and we'll talk about how to alleviate that. But for 2021, the Part B premium is $148.50 a month. Remember, I just said Part A, if you're covered under Social Security, there's no premium. But Part B, regardless of whether or not you are eligible for Social Security, you will have a premium attached. Just because you're receiving Social Security benefits, just because you're eligible for Social Security benefits, you're still going to have that premium. And by the way, that premium, that's $148.50, is automatically deducted from your Social Security check. If you're not receiving Social Security, then you're going to have to pay this premium, and you probably want it automatically drafted out of your account, out of your bank account, in order to make sure that that's paid, because there's penalties if you do not pay that premium. There's also what they refer to as income-related monthly adjustment amounts, which is commonly referred to as IRMA. If your modified adjusted gross income for 2019 fits in any of these categories, you're going to have, your premium is going to be more than the $148.50, because again, this is the baseline. This is what everybody pays. But for instance, if your modified adjusted gross income is $500,000 above, you're going to pay the $148 plus the $356. That's that income-related monthly adjustment amount, or IRMA. It's going to be automatically deducted from your Social Security check. If you're getting a check, it's going to be deducted from your bank, which I recommend it be deducted from your bank. It doesn't have to be, but you want to keep this as simple as possible. Those are the figures for 2021. So let's talk about additional costs that are specific to both Part A and Part B. This changes every year. The reason why I put 2021 here is because these amounts change every single year. Typically around this time every year is when the changes are announced. I haven't seen them yet, but I expect them anytime around the September to October timeframe is when changes for the next year are announced for Social Security and Medicare. But for 2021, your hospital deductible, right when you go in and you use your Medicare benefit, got a deductible of $1,484. You also have daily copayments with your hospital stay, and it varies for which day you are in. For the first 60 days, there's zero copayment. For the next 30 days, from day 61 to day 90, you have to pay $371 a day. And from after the 90th day, you have a lifetime $742 per day. And again, we'll talk about that in just a minute. Daily skilled nursing facility copayments, $0 for the first 20 days, $185 for the next 100 days. Remember, I said 100 days is the maximum amount of time you can spend in a skilled nursing facility for which Medicare will reimburse you for. After that 100 days, Medicare drops off, and now you're going to have to look at long-term care, some type of long-term care policy or protection. Part B, the annual deductible is $203. So when you go to a annual wellness visit or a cancer screening, you're also going to have coinsurance. That's where you're going to write that check for 20% of whatever that cost for your annual checkup is, or for that cancer screening, you're going to incur 20% coinsurance there that you need to cover. And once again, there's no maximum out-of-pocket limit. That's why you have Medigap policies, and we'll talk a little bit more about that as we go along. So let's talk about a benefit period, because in the previous slide, I just mentioned the hospital deductible is $1,484 per benefit period. How does a benefit period work? Well, a benefit period starts whenever you are admitted to the hospital. Okay, not Not there to get a checkup. Whenever you actually, the day that you are admitted to the hospital, the clock starts. Your 60-day window starts. That is one benefit period. It's possible where you can have multiple benefit periods in the same year. So if you go in the hospital from January 1st through February 28th and into March, you use your 60 days at the beginning of the year, and then you go in the hospital in the fall, that's another benefit period. That results in another $1,400. So just because you covered that $1,400 once earlier in the year doesn't mean that you can't again incur that $1,484 because it's per period, and you can have multiple hospital deductions in one calendar year. That's why we want to look at Medigap policies, because Medigap policies could potentially cover this. Medigap policies are issued through private insurers, and we'll get into that. Well, let's talk about your copayments. This is how it would work if you have an extended stay in the hospital. I want to talk specifically here about your lifetime reserve days. So we just talked about the first 60 days, right? You have zero cost the first 60 days. Medicare is going to pick up 100% of the cost with the exception of that $1,400, right, which is your deductible. Was $1,484. That's your deductible. And then Medicare is going to pick up 100% from the first 60 days. Then days 61 through 90, it's going to cost you $371 per day over this time frame. And then after that time frame, you're going to have $742 per day for 60 days after the 90 days. And by the way, this is a lifetime reserve, meaning that once you use this, once all of this has been exhausted, you don't get it again. So let's say that you're 66 years old, you go into the hospital for 120 days. Excuse me, longer than 120 days. You go in the hospital for 6 months. You use your lifetime reserves of $742 a day. Okay. And by the way, that's your out-of-pocket cost. Medicare is going to pick up the rest, but you've exhausted that lifetime reserve. You go in the hospital next year, and after day 90 in the hospital, because this is yearly, these hospital co-payments are yearly, but once in the very next year, if you go in and you spend another 91 days in the hospital, on that 91st day, 100% of the cost of that hospital stay is going to be out of your pocket. That's where that Medigap policy comes into play. You're going to pay 100% after the hospital copayments and the lifetime reserves have been exhausted. It can get very expensive. Do not think that Medicare is the end-all, beat-all solution for healthcare, because the out-of-pocket expenses can get cumbersome and can put a dent in your retirement plan. So, been talking a little bit about Medigap policies. We haven't even talked about Medicare Advantage plans, but I want to focus on these two areas because these Medigap policies can really prevent you from having a lot of excess cash come out of your wallet, because the Medigap policies very simply help cover your out-of-pocket costs. And important thing to distinguish here is these Medigap policies are private insurance companies. They're not issued through the government. Only Part A and Part B are. So Medigap and Medicare Advantage plans are issued through private insurance companies. In order for Medigap policies to pay, the services have to be approved by Medicare. And so we'll talk about this in a minute, but common services like vision care are not covered under Medicare. So we may end up having to have some additional insurance there to cover some of those common services. But Medigap, very simply, you have 8 to choose from. You have Medigap A, Medigap B, Medigap D, G, K, L, M, and N. And each one of these, as you can see here, and I'm not going to spend a whole lot of time on these. If you need specific information or you want copies of these slides, let me know. I'll be more than happy to get them to you. They're also available on Medicare.gov. Tells you exactly what each Medigap policy covers. The more that the Medigap policy covers, guess what? You're right. The more expensive it is. For those that are newly eligible for Medicare in 2020, C and F are no longer available to you. So that's why I said earlier there are 8 options for you. A, B, D, which is common. I see that a lot, which is your drug coverage, G, K, L, and M and N. Okay. Important thing to know here is that Medigap is guaranteed to be insured 6 months after enrolling in Medicare. For up to 6 months after you enroll in Medicare, regardless of your underlying medical conditions, Medigap insurance can help you. You will get it. Now, your premiums may be a little different, but you can get it. It is guaranteed to be issued. I want to talk about Part D. Part D is the drug Medigap policy. What does it cover? Basically, once again, it's run by a private insurance company. You have your choice of what Part D Medigap policy you want. You'll have to determine what are your prescriptions that you're taking and what Medigap Part D policy covers that you're taking. And you can choose. The choice is individually up to you. There's many private carriers that have Part D Medigap coverage. You just have to see what fits you best. And there's a lot of variations among them. As your life changes, this Part D should be reviewed every year because your prescriptions are going to change. And that open enrollment period, which starts in October 15th to be more specific, and goes till December 7th. Every year between October 15th and December 7th, roughly that time frame, but every fall between those two dates, you can change your Medicare coverage. So you can change your provider of your Part D. Okay. Much like Part B that we just talked about, you are subject to IRMA, the income related monthly adjustment amount with Part D. Exact same thing here is that you make $500,000 above, you're going to add on another $77 to whatever your premium is on that Part D. And once again, that Part D premium is going to vary, depends upon how much coverage you need. So go through your list of prescriptions and find out which coverage is best for you on Part D. Because you can switch plans as your medical situation changes. What's not covered? Well, some of the more common procedures that I see are some common services that are not covered under Medicare Part A and Part B. Dental, vision, hearing, long-term care. We talked about that earlier. If you need to go into a long-term care facility, you need 24 hours a day care because you can't do the activities of daily living, which is bathing, dressing, eating, and moving from place to place, such as from the bed to the kitchen or a bed to a chair, or continence, or being able to go to the bathroom. Those are daily activities, and you can't do those. You're going to need long-term care, and that's not covered in Part A or Part B. We need a specific insurance to cover that particular need. But these are, again, some of the more common services that I see our clients using that are not covered by Part A and Part B. You need to be aware of these because that's where you look at a Medicare Advantage plan as an option. Now, this is Part C. We talked about this earlier, and we haven't spent a whole lot of time on this, but this is an option available to you. The Medicare Advantage plan essentially is, remember the HMO and the PPOs? These are common type of policies where your benefits are greater, but your area of coverage is much smaller. So with the Medicare Advantage, you get the exact same services as Medicare. And in many cases, you'll get more. And once again, the copays are going to vary, but you have limited geographical coverage. So earlier I talked about snowbirds. So if you live in Missouri and you travel down to Florida every winter to avoid the cold weather here, I don't like shoveling myself. But if you don't like the cold weather here and you're a snowbird and you go down to Florida, Texas, Arizona, wherever, they may not be able to take care of your medical needs where you're at, not unless you have a national Medicare Advantage plan where you have a chain which covers you in various different states. But once again, Medicare Advantage is issued through a private insurance company. The reason why it's advantageous to you is because it puts a lot of coverage into one plan. There's not the need for Medigap insurance, in other words, and that is an important advantage to some people. But you have to stay within network, right? Just like a traditional HMO and a traditional PPO. If you don't do a lot of traveling, if you stay at home, maybe the Medicare Advantage is something that you should look at because it could be more cost effective for you. But if you're planning on traveling, being a snowbird, maybe traveling outside of the country, most Medicare Advantage plans would provide for you for your emergencies, but you might want to think about purchasing a separate travel insurance policy to provide you more complete coverage because the Medicare Advantage plan is going to be limited if you plan on traveling outside of the country. So certainly another consideration that you need to have. And if you're going to travel inside the United States, then I would make sure that wherever your destination is, that they have a Medicare Advantage plan that's local that provides you coverage where you're at, in addition to your home base. So, question I get a lot is, which is better, Lon? Medicare or Medicare Advantage? I have no idea. And unfortunately, I don't have an answer for you. It depends upon your situation, what you want out of your care. But what I do want you to do is I want you to determine which plan, whether it's Medicare or whether it's Medicare Advantage, which plan fits best into your retirement. Also depends upon your health. That's the second major factor. Because remember, in Medicare, that Medigap insurance that you choose, depending upon your health circumstance, you choose a Medigap policy. It's guaranteed to be issued, but you're going to pay a premium. Whereas the Medicare Advantage may take care of that additional need for you. You're just going to have to compare the cost and compare the plan. But I would say if cost is not an issue, maybe the original Medicare along with Medigap insurance is going to give you the most flexibility. You can see as long as the doctor accepts Medicare, you can see them. Doesn't matter if they're in Florida, Oregon, Texas, Illinois, Carolina, it doesn't matter. They accept Medicare, you can see them. So it's going to be a lot more flexibility. But if you want comprehensive medical care and you're not traveling much, boy, this Medicare Advantage, boy, that looks really attractive. Okay, so it just all depends. There's not a right or wrong answer. There's no solid answer. There's no you have to have it. So let's go ahead and talk about what I want you to take away today and what the next steps are. What we talked about, and man, did we talk about a lot. Holy smokes, I threw a lot of numbers at you. And by the way, I hope you were not writing those numbers down because you don't need to memorize those numbers. That's why we're here. Use this as a resource. You'll be able to replay this webinar at any time. If you want some of these slides to take a closer look at them, please email me, reach out to me, and I'll be more than happy to get you some of these slides that have all the numbers on them. But key takeaways, Medicare, if you're over 65, be prepared to get the onslaught of marketing materials, and hopefully Medicare.gov will send you something as well. You're going to get a lot of information about Medicare. Medicare is not free. You got to pay for it. If you're on Social Security, it'll be automatically deducted. If you're not on Social Security, you got to pay for it. You got to pay for it, either write a premium check or have it deducted from your bank. If you're on Social Security benefits and you turn 65, in other words, you enrolled early, you decided to take your benefits early at age 62, so you're receiving a Social Security check at age 65, you're going to be automatically enrolled in Parts A and B. If you're not receiving Social Security, that's where that 7th month window where you have to enroll. Okay. That's that 3 months prior to your 65th birthday and 3 months after your 65th birthday is that enrollment period if you're not covered under Social Security. Because Medicare is a massive federal program and you have to follow the rules. Other choices or other things about Medicare is you can either do the original Medicare, which is Part A and Part B, your father's Medicare, or you can do the new Medicare, which is Medicare Advantage, which is Part C. Keep in mind, if you do choose Parts A and B, you've got to backfill the gaps in coverage of Part A and Part B because there's coinsurance amounts, there is deductibles, and there's no lifetime maximums with Parts A and B. That's where the Medigap and Part D come into play. Original Medicare, if that doctor that you're seeing accepts Medicare patients, and you want to ask before you go and see a doctor if they're accepting Medicare patients, or if they accept Medicare, then you can go see them and you're covered. But the Medicare Advantage often covers more, gives you more coverage. It covers some of the things that the Medigap policies that you have to pay for would cover. Medicare Advantage may provide more coverage at a lower cost, but it's going to be less flexible. So a lot of different things to consider with Medicare because it is a massive government program. And again, this is just designed to give you an overview. Anytime we meet with a client, especially if they're getting ready to retire, this is an important topic that we'll talk about. And we do have a Medicare expert here in our firm that sits down with our clients and does nothing but Medicare planning. Next step is start a conversation with your advisor. Healthcare is one of the most important topics you can discuss in retirement. And interestingly enough, it's one of the most overlooked aspects of retirement. We all think that our health care expenses are going to be taken care of through Medicare. And we just demonstrated to you that cost in Medicare can be cumbersome. Next thing I would encourage you to do is go to the National Council on Aging. Their website is the National Council on Aging, nca.org, ORG. This website, they have a Medicare tool, one of the best tools that I've seen, called My Medicare Matters, where it asks you a series of questions and it provides you with some detailed information on why a particular option may fit you better than another option. So if you have time, go to ncao.org and use the My Medicare Matters tool. It will be a tremendous help to you. It has been to some of our clients in the past. So thank you for taking the time to spend with us here today. If you have any questions, reach out to me. I can be reached at lbroske@pineswealth.com. Email me, give me a call. I'd love to talk to you about Medicare, or you can go to our website at pineswealth.com and reach out to us, make an appointment directly on our website, and we'll be more than happy to spend some time with you and explore your Medicare options. Thank you for taking the time. Have a great week, and we'll see you next time in our webinar series.